I am Dr. Carey. I am a pediatrician in Ventura, California, and we are talking baby care. Today, I'd like to introduce two guests who have joined me to share their child's experience with diarrhea. Yes, you heard me right. We are going to discuss this very unpleasant topic and learn a bit about when one should be concerned for your child. This is Anjali, the mother of Michaela, a happy little 7-month-old, and Janine, the mother of Abigail, who is 23 months old and about to celebrate a birthday really soon. Wonderful. Welcome.
Thank you. Hello.
Hello. Janine, why don't we start with you? Why don't you tell me a little bit about your child's last illness when we had a wonderful bout of diarrhea? What happened?
The diarrhea started and lasted probably about 5 days. It was actually just, all diarrhea for about 5 days. And we were getting a bit concerned, so we had called the doctor, your office, and they had told us that it could last 3 weeks, which was kind of surprising. I didn't know it could last that long. And so they just said, keep her hydrated and make sure there's no blood in the stool, which there wasn't. So we felt okay with that. And then over the weekend, she had developed a fever starting Monday. She had a fever for a couple of days before we brought her in to see you to see what was going on, because the diarrhea had been for about a little bit over a week then, along with the fever. And you checked her out, said everything was fine, just keep her hydrated, give her Advil or Tylenol for her fever. And then a couple days after that, she started vomiting, so which is the worst for your child, because you can't actually do anything, so you just feel very helpless. And then I called you again. You were getting lots of phone calls and texts from me during this period, and we just kind of waited and saw what happened, and she kept her hydrated, and probably the whole thing resolved after a little bit over 2 weeks of diarrhea and vomiting.
Mm-hmm. How about your child?
In my case, mine was 2 months old, so I think that's scary because she was young. And it started on a Monday, and she had I would say 7 dirty diapers that day. So I called you, and you saw her on Tuesday, and what we did is just that I was breastfeeding every 4 hours, and then I started to feed her every 2. That keeps going for 5 days, and it was really scary, but she was fine. So.
And I think some people are surprised about how long diarrhea can last. Mm-hmm. First off, the normal stooling cycle for anyone can be anywhere from 7 per day to 1 every 7 days, so the range is huge. Usually for newborns or very young ones, reflexively they want to poop about 20 to 30 minutes after a meal, and considering one is breastfeeding or bottle feeding very frequently, we tend to get a lot of diaper changes in a very short amount of time in children. And then something happens, and I have no idea what it is, but at 6 weeks of age, you can mark it on your calendar, most children start pooping less. So suddenly it slows down, don't know why, you're sort of happy about it. You might get a little more fussy because of things, but at least you're not changing as many diapers. And then when the diarrhea starts though, and then we end up with a change in the substance, it becomes more loose, more watery, and many more, then we really start to wonder what's going on here. And there certainly are reasons why one should worry. And what was your biggest concern with your child?
Mine was mostly dehydration, and also, and this sounds weird, my mind was more on the what ifs. I'm kind of really analytical, and lately I've had a couple friends whose kids have cancer, and those are all, they always say, oh, we just thought the symptoms were flu-like symptoms. And so then you start to wonder, when they last for a lengthy period of time, if it's something more than just a virus.
Right.
And so that's where I get a little nervous, and I start to overthink things and panic. And so, I try to stay calm, but you help more with that than me staying calm on my own. And that's more what was concerning me, was that something more was wrong than just a virus.
Mm-hmm. What was your biggest concern? We had a 2-month-old.
My concern was that she was so young, and she looks like she was in pain. And when you have your child going through pain, I think that's really scary. And my fear was that this was going to be something else. So that was my biggest fear at the time.
And certainly when taking a look at any child, most pediatricians and physicians are on the lookout for the odd things that can happen, but certainly the number one concern, especially in a 2-month-old, but in anyone, is dehydration, because we lose a lot of fluid during a course of diarrhea. And trying to make sure that they're drinking okay and keeping hydrated is really important. When they're not throwing up and they're taking fluids and we can keep that fluid coming in, that's really much easier. When we have an episode when there's vomiting involved, then you have to really be a little more cautious to make sure that we're not getting dehydrated. I think in really little children, especially when they're just a couple months old, when they're having that much diarrhea, it's really important for them to be seen and assessed, because they can get dehydrated within 6 to 12 hours. The older they get, they can go quite a bit longer, especially if they're drinking fluids pretty well. But trying to get a sense for how their hydration is really important. What do you do to decide whether your child had enough fluid?
She is a big water drinker, so I have a tendency not to worry about that because she kept urinating. But as she had the fever and the vomiting and the diarrhea, I got a little bit more concerned, because with anyone, I mean, if she can't bring in fluids, how can she retain any sort of hydration? So that was a concern. I just mostly kept an eye on how many wet diapers she had and just kept a continual line to you.
Right. And how about you?
That's what I did too. Wet diapers, dry mouth, and if she seems like she wasn't very sleepy or so what I did is just that I was feeding all the time, just to make sure she was doing fine.
And Anjali, especially with the very young ones, looking to see whether they are interacting or whether they seem overly sleepy or tired is so important, because at 2 months of age, they just don't have many ways of telling you what's going on. So when they stop acting right, then you really have to keep your antenna up and know whether we need to do a little bit more than just simply keep feeding. Some people have talked about in the past, you change the diet or do something more bland. I tend not to do that. Certainly the milk will cause a little bit more diarrhea, but the lactose in it will. But we're also depriving them of nutrition, and that gut needs to heal, because when we're getting that much diarrhea, what happens is the lining of the gut has pretty much become injured, and it's not absorbing water the way it's supposed to, and everything's coming out pretty fast. And it's important for that gut to heal, and the way that gut heals is to get nutrients. And therefore, if we can try to keep to a regular diet, if we can try to keep to the kinds of things a child wants to eat, things will heal much better. Maybe increasing the frequency of breastfeeding is really a good way of making sure that we're getting enough in. Your child drinks water really well, and we can push that a bit more on top of it. But sticking with as much of a basic diet as we can whenever possible is really a great way of helping resolve things. Now, there are certainly things that make one concern besides the dehydration, which is a reason to certainly see the physician right away. Blood in the stool is one that makes me wonder what's going on, because a lot of infections present with bloody stools, and sometimes we do things about that, sometimes we don't, but it's important to check them out and see what's going on, and maybe get a culture of the stool and see what's growing in them. The green isn't always a good sign of what's going on. It just means things are going through the gut very fast, and it's very common for babies to have green poops, so you never really know whether it means anything. Some will say, a lot of mucus in the stool is an indication of infection, and it certainly can be, but for every child I've seen who had mucus in the stool from infection, there are plenty of others who have it just for whatever reason, and one never really finds a source. Now, did either of you travel outside of the country at all during this time?
No. Actually, I think I did 2 days after this happened.
After that happened, but not before?
But not before.
Okay. I often ask about travel exposure, because certainly going to other countries, one can possibly pick up something that will cause a lot of diarrhea. And then pets. A lot of unusual pets, lizards, salamanders, turtles. It's not too often that a 2-month-old is playing with a turtle, but certainly pets like that can transmit some diseases that can cause infections. Another thing to consider are medications. Was your child taking any medication to begin with in either case?
No.
No, okay. And how old was your child when all this happened?
It was just last month.
Okay, so it was just and then we have an active little one who's all over the place, who's getting into things, and then you have to wonder, did we get into something? Did we eat or ingest something? Did we get into a medication? Did we get into something that would have caused some stomach irritation? So it is even more reason why childproofing and making that house safe is so key, isn't it?
Especially when my child figured out how to open the childproof locks. So everything in our house we have to keep up out of the way, including up out of the way of her getting onto a chair. She climbs onto everything. So I found her on top of counters, and she brings her little chair everywhere to help her reach things. So for us, it's more just keeping everything up high or in locked rooms.
And I've heard of some parents using different kinds of locks on different cabinets just to sort of mix it up and get them, not that it's more of a puzzle for them or anything.
The only one that works is those magnetic locks.
That worked well for your...
We have them in her room because we just keep the little magnet somewhere else that she can't get to, so she can't open it. But anything else that has a latch where she pushes, she watches everything we do, so she does exactly what she's seen us do, and she's figured it all out.
Childproofing can certainly be a challenge. Some parents wonder whether to bring in a sample of stool for the physician to see. Some physicians will say yes. The gastroenterologist I trained under during residency would call it stool gazing. He liked to. Some would rather not take a look, but it's probably, if there's a lot of blood or something else going on, probably good. I think I can never walk into a supermarket ever again in the dairy section because of mom who brought in a container of the country crock filled with. It turns my stomach to this day. So to that. But when it comes down to it, the take-home is that diarrhea can last a little bit longer than people expect. Certainly after a week of diarrhea, of just straight diarrhea, if the child isn't dehydrated, there is no fever, there's nothing else, and you watch it for a number of days on older children, there's no problem with watching for at least a week. At some point, it's important to touch base with the pediatrician because they may want to do something about it, and little ones should be seen right away. Again, I thank my guests for sharing their experience with us. I'm Dr. Carey, and I thank you for watching. For more baby care education and to sign up for our free newsletter, please go to drcareys.com. We're at Dr. Carey's We Teach Baby Care. Thank you.
Thank you.
Breathe in, breathe out. Breathe in, breathe out. Okay. Let me see your ears.